Whether during foreplay or the main event, fingers can be incredibly pleasurable for a woman when used well. In fact, with the right technique, some women can reach orgasm from fingers alone. Fingers bend, adjust pressure, change angles, and scale from one finger to two or three. They are precise tools far easier to control than anything straight and rigid. I'm Dr. Thomas, urologist and sexual health expert. Today, I'll walk you through a step-by-step, respectful, medically grounded approach to using your hands so the woman you're with feels safe, seen, and deeply pleasured. First, two essentials before any touch: consent and preparation. Ask clearly, "Do you want me to touch you here?" Keep communication open the whole time. Then, prepare properly. Trim and file your nails smooth. Wash your hands and under your nails with soap and warm water. Remove rings. If dryness is likely, keep an unscented water-based lubricant nearby. Clean hands prevent micro-scratches and reduce infection risk. Lube prevents friction. These are non-negotiables. Step 1. Warm up and teasing arousal for many women is a full-body process, not a switch. Start away from the genitals entirely. Make out. Kiss the neck, collarbones, and inner arms. Stroke the lower back, hips, and outer thighs. As you approach the inner thighs, deliberately slow down. Over clothing or underwear, press your palm gently over the vulva and hold, then release. Trace the edges of the underwear fabric. The goal is steady, playful pressure, waves on and off, so anticipation builds. Teasing is not filler, it is fuel. It drives blood flow to the clitoris, labia, and vaginal entrance, which amplifies every sensation that follows. As a physician, I can tell you this physiologically. Engorgement of the clitoral tissue and labia increases nerve sensitivity significantly. Every minute spent in this phase pays dividends later. Step 2. External touch first. Slow and gentle with underwear still on. Outline the outer lips and inner thighs with light strokes. When she says yes to skin contact, slide a fingertip along the outer lips, then the inner lips. Keep your touch slow and exploratory. Circle around the hooded clitoris rather than directly on the tip at first. Most women find the bare clitoral glands too intense at this stage. Think feather strokes, then light circles, then slightly firmer ovals. Watch for breath changes, hip movements, and small sounds. Those are your green lights. Read the body. It communicates clearly when you're paying attention. Step 3. Add rhythm around the clitoris. Every woman's sensitivity is unique, but most prefer rhythmic, consistent patterns over random, unpredictable contact. As a man who has counseled hundreds of couples through sexual health concerns, I can tell you this is the most commonly overlooked principle. Try a gentle around-the-clock circle, just outside the clitoral hood. Try vertical strokes from the pubic mound downward to the vaginal entrance, then back up. Try side-to-side figure eights around the hood. Use 2 fingers together for broader contact if she prefers more surface area, or a single fingertip for focused precision if she prefers intensity in a smaller area. Ask short, specific questions: softer or firmer, faster or slower, higher or lower. These are not awkward questions, they are the difference between average and exceptional. Step 4, when to go inside and how wetness signals arousal, but it does not automatically mean readiness for internal stimulation. Always check in. Do you want me inside? If yes, add lubricant if needed and begin with 1 finger. Never insert dry. Glide slowly into the vaginal entrance and pause just inside, giving the pelvic floor muscles time to relax and accommodate. Use a slow, deliberate come-here motion, curling toward the front wall, not fast in and out thrusts. Fingers excel at angles and applied pressure, not speed. Explore gently, a few millimeters up, down, left, and right. If she tenses, withdraw slightly. Breathe together and return to external touch. Tension is information. It means slow down, not push through. Step 5. Find the anterior sweet zone, 1 to 2 inches inside on the front. Belly side wall, the tissue often feels slightly spongy or ridged. That anterior zone, commonly referred to as the G-spot area, becomes more pronounced and accessible as arousal increases. Curl your fingertip toward it in a slow come-here motion. Begin with light taps or short strokes, and build pressure only when she asks for more or when her body clearly presses into it. Many women prefer a steady, repeatable rhythm far more than sheer force. Keep your other hand free, hold her hip, stroke her lower belly, or maintain external clitoral stimulation with the pad of your thumb if she enjoys blended stimulation. That coordination between internal and external touch is where the most powerful responses tend to occur. Step 6. Scale thoughtfully. 2 fingers in coordination if she wants a greater sense of fullness. Partially withdraw, twist slightly, and insert 2 well-lubricated fingers together. Maintain the curl so your fingertips stay in contact with the front wall. Combine your motions. Inside fingers perform a small come here motion, or tiny arcs, while your thumb or opposite hand maintains a consistent rhythm around the clitoral hood. Small movements go a long way. The more aroused she becomes, the less dramatic the motion needs to be. Pressure and consistency become the dominant factors at this stage. Step 7. Adjust pressure and speed near climax. As she builds toward climax, her cues will intensify. Hips press forward. Breathing quickens and deepens. Sounds change in character. Thighs may begin to tremble. When you identify a pace and pressure her body is clearly responding to, do not change it. Hold the pattern steady through the finish. If she says right there, treat it like a fixed coordinate. Stay with it. Many climaxes are interrupted at the last moment because the stimulation shifted. That one mistake undoes everything that came before it. Step 8. Variations many women enjoy hood strokes. 2 fingers forming a V. Gently sliding the clitoral hood up and down without directly exposing the tip. Highly effective for women who find direct contact overstimulating. Outer to inner wave, a long stroke from outer thighs to inner thighs to labia, then back outward. This resets sensitivity between peaks and keeps the nervous system engaged without overstimulation. Pressure hold, a broad, warm palm over the vulva with a still, gentle press. Very calming between peaks. Many women find this deeply reassuring during or after intense stimulation. Angle shift. Place a small pillow under her hips. This changes the angle of the anterior wall significantly, making fingertip contact with that front zone far easier and more consistent. Step 9. Hygiene and comfort. Short nails, clean hands, and adequate lubrication prevent micro tears in delicate tissue. If you transition from any anal contact back to the vulva or vagina, change a glove or wash thoroughly before continuing. This is basic infection prevention, not optional. If she experiences burning or pain, stop immediately. Add more lubricant and return to external touch only. Sharp pain is a clear signal to stop. Warmth or mild stretching is only acceptable when she explicitly confirms it is comfortable. Step 10. Talk then aftercare. Right after a peak. Maintain your touch but gradually lighten pressure as her body unwinds. Many women appreciate being held, stroked gently on the ribs or hair, or having their thighs lightly massaged. Offer water. When she's ready, not immediately, ask one short, genuine question. What did you enjoy most? Remember the answer. That is the real, lasting playbook. A few truths most men never hear. Not every woman reaches climax through internal stimulation, and that is entirely normal. Many women prefer clitoral-focused touch only. Others enjoy a blend of both. The single best way to know is to observe, listen, and ask directly. And understand this, the emotional environment matters as much as technique. When a woman feels genuinely safe, admired, and unrushed, physiological changes follow. Blood flow improves. Natural lubrication increases. Pelvic floor muscles release tension. Pleasure rises, not because of a new technique, but because of how she feels in the moment with you. As men, we are often conditioned to perform rather than connect. The most effective thing you can do is slow down, stay present, and treat her responses as the guide, not your assumptions. If you found this helpful, subscribe and share it with someone who wants real, respectful guidance. Your hands can become extraordinary instruments when you apply them with patience, precision, and genuine care. And for men who want to go one step further in supporting their own performance, there are natural supplements worth considering. 2 that Dr. Thomas recommends most frequently: organic watermelon extract, rich in the amino acid citrulline, which supports nitric oxide production and healthy circulation, and an advanced formula combining ashwagandha, tonkat ali, fenugreek, nettle root, and citrulline to support every dimension of male performance. from erections and stamina to testosterone balance and prostate health. Links are in the description and pinned in the comments below.